So actually, first of all, I need to say welcome to Shijiazhuang Kidney Disease Hospital in China, and then you has received the treatment in our hospital, right? So could you please give us a brief introduction about yourself, such as where are you come from, what's your name?
Okay.
Yeah.
Well, I have the pleasure to say that I am Osman Hussein Muhammad. I come from Somalia, but currently I work and live in the Kingdom of Saudi Arabia. In fact, I was sick for over 10 years now. In the beginning, I have high uric acid.
Yes.
Later on, I developed high creatinine.
Mm-hmm.
And that's why the doctor is there. They put me on dialysis for over 1 year now. During that year, or the previous year, my condition was, you can say, deteriorating almost.
Yes.
But the frequency was less. Before I started dialysis, it used to increase. Up to I reach a point that the doctor has no other solution except to put me on dialysis. During the dialysis, there was some sort of stabilization. In addition, I have also high BP.
Yes.
When I come to know about this hospital,
How you found this hospital?
I find through the internet. I check the kidney disease hospitals all over the world. When I check their website, I find this hospital the most suitable for me.
And then, because in the world there are a lot of hospitals where can treat the kidney disease, we just want to know what attracted you to come to China.
Yeah, what attracted me is that in this hospital they are using a different technique and approach. That is the Chinese micromedicine.
Oh, you mean the micro-transmission
Yeah,
osmotherapy?
Chinese medicine and machine, all techniques.
Yes, because we want to know, could you please tell us what kind of treatment did you receive since you came to our hospital?
I receive, of course, the treatment normally the hospital gives to a patient of my condition. Normally when I come, they did the tests, and upon the tests, they discuss. Then they make a plan for me. That plan included medicine and practical treatment like osmotherapy and foot bath.
Yeah.
And what do you call the other one?
Anima?
Yes.
Have you ever used?
Yes, anima.
Yeah.
Yeah.
And any other treatment?
No, they gave me all medicines, injection and tablets, capsules, mostly Chinese plus Western.
So
for the kidney and for the BP also.
Yes, because I want to know, you have mentioned that you have studied dialysis for almost 1 year.
Yeah.
So before you came to our hospital, what kind of dialysis method did you use in the past? And once you came to our hospital, to kidney disease hospital in China, what kind of dialysis did you receive here?
Previously, for 1 year, I am only on hemodialysis.
Yes.
When I came here, in fact, I find a different type of dialysis. That's called hemofiltration.
Yes.
Yes. And this is very, very effective, really. I find it very, very effective. because when I check my creatinine after the dialysis, it's very, for the first time it has reached a level it never reached before.
Yes.
Yes.
Yeah, actually, for the dialysis methods in our hospital, because we has used the hemofiltration, including the plasma exchange and the immunoabsorption, those kind of dialysis method to help the patient. But right now, do you have any idea about the difference between the hemodialysis and the perfusion or hemofiltration?
Yes, as a patient, I can feel the difference. I feel the kind of dialysis you have here, what you call hemofiltration, this is more effective.
So it means the toxin
removal is higher.
Yeah, removing higher.
Toxin removal is higher, so it's more effective than the normal hemodialysis.
Yes.
Yes.
And there is another question that have you ever observed your urine, such as the color of the urine, the smelling of the urine, since you came to kidney hospital in China?
Yes. This they teach me here also, this thing, because before I didn't know this. This they teach me, yes, and I know.
So
the doctors here, they teach me how to check, and then I know now. But the volume have increased from the beginning. Yeah. So I am here for 15 days, and I am glad to say that my condition has improved a lot. I have benefited a lot, and I really appreciate and thank everybody, all the doctors and the nurses and the group here. Yeah.
And one more thing I want to ask you, since you said before you go to the washroom during the night, maybe 2 to 3 times. How about the daytime, before and now?
Before daytime, I don't have urine at all. Mostly.
So, yeah.
In the night time, maybe once or twice. But now, daily and nightly, I'm going. Before, sometimes I go to the toilet only. I try to give urine myself to force out. But now, I am coming back to normal. Now the urine comes and I feel I have to urinate.
Okay.
So I go for urine.
Yeah, actually that is a good sign for you. And then there is another question for you is, would you like to say something to the patient who needs the help in the world?
Yes, I will just encourage them to come to this hospital, and I am sure their condition will improve once they take the medicine and they undergo the other practical treatment. Yes, mechanical treatment also. Then their condition will improve surely, as similar to my condition. Because in short time I feel a great improvement, and I wish everybody could benefit from the services of this hospital and what's offered here. So it will be very nice and very good for their health.
Okay, thank you. And as you mentioned, you have seen the improvement since you came to our hospital until now, right?
Yes.
And then we want to know, before you go, would you like to say some words to the staff here? I mean, since the doctor gave you the treatment and the nurse gave you the service, how is the treatment and the service here?
It is very nice, and I am personally satisfied, very much satisfied. So I will say, well done and keep up.
Thank you.
Keep up the same spirit work, the same team spirit, and you will succeed more.
Thank you.
Yeah,
And
good luck to everybody, yes.
And as I told you, the reason why we want to share this video to the patient, because we want to know more we want to help more patients and let them recover.
Yes.
And then, would you mind us to put this video on our website?
Yeah, no problem.
So just to show the patient who need help.
Yes, yes, no problem.
No problem.
No problem. I have no objection, yes.
And then
As far as it's beneficial for the patients and for the hospital, I have no objection, yes.
yeah, frankly speaking, I really appreciate. And then in the end, I just want to say, on behalf of all staff of international department, we sincerely hope you will get well soon.
Yes, thank you very much. And I hope so. And if that happens, it's only thanks only to the doctors here and the nurse here and the treatment I got from here.
Okay, that's good.
Yeah.
Thank you so much.
Okay.
Yeah.